Rural doctors in Ireland work in some of the more remote parts of the country, where there aren't many healthcare options for people. If rural medicine is something that interests you, you might be perfect for the jobs available in rural regions of Ireland. And there are tons of benefits that will come along with working in the rural family medicine field. In this video, we'll go over important things to know about a rural family medicine career. The only doctor. More often than not, there will be only one doctor in a rural area, and that doctor will be responsible for seeing and treating everyone in that area. The good thing about that is that it obviously limits the competition that you'll face when you set up a practice. But the bad thing is that it means you'll be working alone for the most part, without the chance to seek second opinions from colleagues. Dedication. Most rural doctors keep pretty regular business hours. They'll have offices that are open from 9 a.m. to 5 p.m. on weekdays. But since rural doctors are the only doctors in the area, they also usually have 2 nights per week where they're on call. This means that they'll need to stay by their phones just in case anyone has a health problem after business hours are over. Rural doctors will also typically need to take urgent calls on weekends and on nights when they're not technically on call. Since those living in rural areas don't have any other healthcare options, a rural doctor might have to provide care at almost any time of the day or night. Rural living. One potential challenge is that you'll need to learn how to live in a rural area. If you happen to have grown up in a rural area, this shouldn't be too difficult for you to do. But it can be tough for those who have lived in more populated areas for most of their lives. Rural areas are much slower and more low-key than urban ones. They also don't have a lot of the amenities that you might be used to if you live in an urban area now. Doing something as simple as grocery shopping will be a much bigger chore in a rural region than in a city. But there are also many advantages of living in a rural area. You'll be able to get in touch with nature. You'll also enjoy more affordable housing options and far less pollution. Attractive stipends. There's a real lack of rural medicine doctors working in Ireland right now. Ireland's health service executive is offering attractive stipends to doctors willing to pick up and move to rural areas. Doctors can collect upwards of €20,000 per year to practice rural family medicine. Doctors can also get an additional €25,000 to hire a nurse and a secretary and to set up their offices the way they want them. This is meant to encourage doctors to, at the very least, consider practicing rural family medicine. If you've thought about taking on a rural medicine career, there has never been a better time to do it. The government is literally paying people to work at one of the most rewarding jobs in the medical field. You should, of course, think long and hard before jumping headfirst into rural family medicine. It's a career that's not necessarily great for everyone. But as long as you're committed to it and perfectly fine with not living in a big city, you'll love the benefits that come with it. You'll also love the challenges that accompany your career and the relationships it allows you to build. Check out our blog to learn more about launching a medical career in Ireland. And if you enjoyed this video, be sure to like, comment, and subscribe.